So in vaginismus, we have a spontaneous and involuntary spasm of the pelvic floor. By that, I mean the muscles around the bottom of the pelvis contract and tense up without a woman wanting that to happen. And so the classic scenario is a woman will go to have any sort of penetration, whether that's sexual, using a tampon, having an examination, and she will feel pain, but also a serious feeling that there is a blockage within the vagina, that the vagina is impenetrable. So what's happening with our model, you can see that the vagina, the entrance here is surrounded by muscular tissue. So all of this here is muscle. So we have Vaginosis muscles running down the vagina, and then we have some transverse muscles across at the bottom of the vagina. And so it's easy to imagine that if these muscles all contract, the entrance of the vagina, that tube that's running up to the womb, starts to narrow, and it feels impossible for anything to get through. So why does vaginismus occur? I always think of vaginismus as a secondary issue, so it would be incredibly unusual for it just to be present. It's usually due to something else, and it's identifying that primary issue that is so important, because actually treating vaginismus on its own will never be enough. We always need to look deeper and understand why the vaginismus has developed. So if there is pain with any sort of touching, penetration of the vagina, then that would understandably lead to a tension, and women will often report feeling like everything tightens up. And on an examination, I often see that tightening and that tension is displayed not just in the pelvic floor, but even in somebody's legs, where they're reluctant or unable to relax and open their legs, and in their buttocks, where they lift off the bed with this tension around that whole area. So things like endometriosis, tears that occur during sex, vulvodynia, a common vulval nerve pain syndrome, and pudendal neuralgia, another nerve pain syndrome, can all subsequently cause vaginismus. The other group of disorders to think about are the psychological issues. So if there is a fear around, for example, sex, then a woman may instinctively develop a vaginismus almost as a protective mechanism, which means she is unable to have penetrative sex. And just some examples of that: if somebody is very fearful of getting pregnant, that may display itself as vaginismus. Equally, if somebody has had a herpes infection in the past and is really concerned about passing that on to a partner, again, that may cause a vaginismus, which actually prevents sex from happening. So when we diagnose vaginismus, we're always thinking about treating that, but also looking for the underlying issue and treating that separately. Physiotherapy plays a really important role in vaginismus management, because it's the ability to overcome that tension and do the exact opposite, which is to relax the pelvic floor. And that's a combination of some breathing techniques, but also some exercises that enable you to lengthen and relax those muscles.